What's up, everybody? My name is Jocelyn. Today I am coming live from Moment of Truth Physical Therapy. I'm actually finishing up my day at work, and I figured since I had a minute that I would teach you guys about teach you how to take more advantage of your foam roller and improve your flexibility and just feel amazing. You're probably looking around and you're like, I don't see that you have a foam roller. And I'm going to say, yeah, I don't have a foam roller. Instead, I have a ball that we can use for myofascial release techniques here at Moment of Truth. And many of you do not have these, but you do have foam rollers, and you can use that as well. So first question, you're probably wondering, what is the difference between a foam roller and this ball? Well, the main difference is the density of the material. So the foam roller is typically kind of hard, whereas this ball has some give to it. And really, I mean, some may have a different opinion, but in my opinion, I can more easily sink into this ball versus a foam roller I tend to guard. And the whole purpose of using a tool like a foam roller or something like this is to promote tissue relaxation versus guarding. And sometimes foam rollers are just really uncomfortable, so it's hard to relax. And so you think you're getting the most out of just rolling the heck out of your tissues, but you could be getting a lot more out of it. So let's dive into the foam roller versus myofascial release part. Why would I use this? Well, just to reiterate, you want to improve flexibility of some sort. So for me, when I was a patient a physical therapy patient for pelvic pain, I was given a ball to basically take what my therapist was doing in clinic to facilitate max improvement while I wasn't in therapy, because I wasn't going every day. So one of the things that I was supposed to do was work on my abdominal flexibility at home with this ball. So for you guys, a lot of you are foam rolling your IT band, which is okay, but same concept. So you want to address the fascial restrictions of your IT band. We're following those same concepts, except I place this into my abdominal wall. And the way I was supposed to do it, though, was not to move around, like roll up and down on the ball or the foam roller if that's what I had, or a different type of myofascial release on the ball, but to sit there for 5 to 10 minutes. So this is what I did. And I'm telling you, it was a lot more comfortable than a foam roller, and I got a heck of a lot of gains out of it. So I put it, if my belly button is here, I put it alongside my belly button on skin, and I started off right here, just laying here. And I practiced breathing the way that my therapist, who is the owner of Moment of Truth, taught me. And that breathing technique is such that my abdominals are expanding, my pelvic floor is lowering, and my rib cage is moving in all different directions. So I started off like this, and then eventually I progressed to this, but I was careful so that I was able to sink into this. And so other positions that I worked on that a lot of people would benefit from is alongside the rib cage. So this was a spot, and again, I went on skin, and I just laid here and I practiced breathing in through my nose and out through my mouth, and just allow myself to sink into this ball that didn't feel so aggressive on my body like a foam roller would. And I stayed here when I had a little bit more time. The goal time was 8 minutes. So on a good day, that's how long I sat there for. And sometimes I would just disperse these different positions that I'm going to show you throughout the day so that I was getting kind of like a meditative effect, breaking up my day with work, with what I was doing at work all at the same time. So another spot that I was instructed to work on, and I have my patients do this, is the upper back, central in the spine. And I just laid like this. While I was at home, I actually had my feet on the bed or the couch so that I was able to relax my hip flexors, because if those are not relaxed, it's going to be really hard to achieve the goal that I ultimately, as a patient, and I ultimately, as a therapist, want to achieve with my patients. So again, I would be here for about 5 minutes to 8 minutes when I was allowing myself to take care of myself, and then I'd switch positions. So another area that a lot of people need, arguably, is the muscular portion of the tensor fascia lata, or TFL, and that's here. And so I would have people lay like either on their stomach or on their side with a pillow supporting, and just a position that they can just sink in and allow their tissues to relax. When you're foam rolling and you're rolling, it's almost like our bodies go into this protective mode and you tighten up. So one thing that I've recently had my patients do, if they only have a foam roller, is instead it's to follow these concepts. It's to just stay there. So you find a spot on the outer part of your thigh, you're there, and you just sink and you just wait. And after about 3 minutes, you're finally able to like relax, because it hurts at first. And then after that initial relaxation, once you reach that 8-minute mark, it has really made a difference. So you're probably wondering, well, why the heck do I have to be there so long? Well, the reason why you need to be there long with myofascial release principles, at least one of the ways that I like to utilize the John Barnes approach, is that the tissue called fascia is time dependent. So you need to be in this position for a certain amount of time before the tissue is actually going to let go. When you're rolling, you don't give that opportunity. Now, there's a time and a place for that approach, and I use that a lot, but oftentimes, like here and around the pelvis and the spine, you don't want that rolling effect. You want that time dependent, just relaxation, body trusts you effect. And you can really work on other components that we typically are incorporating in your care, like breathing, pelvic floor relaxation, chest opening for moms that have tightness here, and then other just mindfulness of like letting go certain areas that have tension, and in addition to the actual area that we're working on. One last position I want to go over, it's an advanced position. I really like this I like this as a therapist to give my patients once I trust my patients as to not like yank and crank on their joints. I really like this for moms, not like right at the breastfeeding part of their life, because it typically is painful, but down the road. It's right on a muscle or over top of a muscle tissue. It's really breast tissue on the top, and then deeper it's muscle, but it's called the pec minor, and this muscle has so much influence on the rest of our body, even though it's so small. So this is just like, this fascial technique at home is literally like so much bang for your buck. So let me show that to you. You're going to be on and again, this is really aggressive. So I don't often give this to people because I don't trust them right away, because I don't want them to have shoulder pain. But this goes right here on my target side, on my right side. I'll demonstrate on both. My right arm is out to the side with my palm flat. I'm gonna keep my other hand here and I'm gonna rotate my body like this. Now, I would have a pillow here or something to support my head. And yes, I am gonna be active somewhat here, but I'm going to try really hard to work on my breathing to let everything else go. So now, the really important thing is notice how my rib cage is all rotated. If it's just my arm behind me without this rotation, I'm gonna crank and yank on the front of my shoulder, and that's no good. So right now, I'm just feeling a massive stretch from here all the way down through my abdominal wall, through my hip flexor. This really is key, this arm here versus it not being there, because it kind of helps keep the rib cage open. So I'm gonna demonstrate on the other side, like this, so right on the spot, not directly over the breast, off to the side, just lower, just a little bit lower than the front of the shoulder. And here, palms flat, I rotate, pretend I'm a pillow, and I am practicing deep breathing. Same breathing techniques as before, except your rib cage is in a different position, so you're gonna have a little bit of a different, I mean, this breathing, it really enhances stretching. Now, I have yet to be able to do this for more than 3 minutes before I start to get symptoms like tingling and numbness in my arm that's back. And I don't want that. I know for myself, this muscle tends to give me symptoms of a syndrome called thoracic outlet syndrome because it's so tight. Thoracic outlet syndrome, there's different subtypes, but basically symptoms are just my whole arm goes numb. I get like the pins and needles in my whole hand. And that indicates there's just restricted either blood flow or compression, tension to a nerve that is in this region. So you don't want to hold it too long that you're getting those symptoms if that is a stretch that your therapist suggests for you. Oh, as a reminder, that is a really aggressive one, but when you do it correctly and execute it correctly and safely, it has massive value and is super important and relevant for women and men with pelvic pain, pelvic floor dysfunction. So one recommendation that I have, that I make with the people that I work with, friends, is make sure that whatever you do, you have a comparison to see if that helped at all. So don't just dive into the movement or the stretch that you're doing. Thank you, sweet D. I'll talk to you later. Yeah, so you want to make sure that you are not just doing it and not certain if it's helping or not. So if you're having issues with, let's say, getting overhead, and you know that you have restrictions here, or you have leakage, and part of it is restrictions, fascial restrictions throughout your body, then practice the overhead movement first. Do the fascial technique at whatever said recommendation that say I give to you, and then at the end, you're gonna retest that movement. For those of you that have knee pain or hip pain with squatting or lunging, you're gonna do that movement first. You're gonna lay on the ball in the way that I have instructed you, and then you're gonna test it at the end. See if it helped. And if it did, continue doing that. If it didn't, continue doing it a little bit longer, because sometimes it takes time to really fall into the stretch or get your body tissues to trust you. So I hope that was helpful. Just as a summary, you don't need a foam roller, but if you don't have one of these balls, foam rollers work really nicely. And the difference is you're holding, because that hold is really key to get the fascia, the system, your body system to just let go and get the effect that you ultimately, whether you know it or not, are looking for. And these hold techniques are a heck of a lot more effective than some of these just roll techniques, because you can really, one, the time effect, and two, you can really work on breathing in those positions, and you don't guard because you're slowly getting into it, allowing your body to trust you. These are my favorite spots here. I like the abdomen. I like the front of the hips, right here, kind of front and side. I like the side here. I like upper back, mid back. And then always remember, I didn't hit this much today, but if you are rolling the heck of your IT band, your hip flexors, or your glutes, maybe, and it doesn't sustain, maybe you need some stability work or isolated work instead of just fascial work or functional training like squats and lunges. Hope this was educational. If you have any questions, please post them in the comments. If you're around in the West Valley, come check out this amazing, beautiful space. This is our yoga studio. You can check out the website, www.momentoftruthpt.com, to see the yoga schedule.